Canine starts now.
Good afternoon, all of you. Today's my topic is Canine Parvovirus and Enteritis. Thanks to Dr. Burhan for helping me to make this video. So, as we all know, Parvovirus is the most common and prevalent viral infection in dogs. It is commonly found in two strains, CPV1 and CPV2, which are extremely stable and are resistant to adverse environmental influences. Originally, strain CPV2 evolved into CPV2A, 2B, and 2C. Etiology: it is a non-enveloped, single-stranded DNA virus. Icosahedral shape and spherical and geometric structure. It requires rapidly dividing cells for replication. Epidemiology: it is commonly found in dogs, coyotes, wolves, fox. It is found in any breed, any age and any sex of a dog. The incubation period of CPV2 strain is 7 to 14 days. Distribution: it is found in Asia, Europe, North America, South America, Africa, and in North India. It is in Jammu. It is 26% incidence of this virus. In Punjab, 30%, and in Haryana, 66%. Susceptible hosts are mostly young pups in the age group of 6 weeks to 6 months. It is due to host with compromised immune status, unvaccinated or incomplete vaccinated dogs. Susceptible breeds are German Shepherd and Rottweiler and Labradors. Transmission is mostly fecal-oral route through fomites, humans, and mechanical vectors. Pathogenesis: the virus enters through coronasal route and multiplies in lymph nodes in broad. Viremia occurs 1 to 5 days after infection. Localizing right epithelium, small intestine, bone marrow, lymph nodes, and myocardium. And we, as shown in picture, it is the main cause are vomiting and hemorrhagic bloody diarrhea. In intestinal epithelium cells, we can see when the animal is normal secretion, normal absorption, we can see here. But when the animal is affected with parvovirus, crypt cell are damaged, decrease in secretion, decrease in absorption, and increase in permeability. Forms of disease are gastrointestinal, cardiac, cutaneous, and nervous. The clinical findings of parvovirus and enteritis are mainly vomiting, diarrhea, anorexia, and rapid onset of dehydration. Feces color changes to yellow-gray or sometimes darkened by blood. Fever 104 to 105 degrees Fahrenheit, leukopenia, and death can occur as early as 2 days after the onset of illness. In myocarditis, it is mainly found in the pups that do not nurse sufficiently or born from unvaccinated bitches. And in cutaneous disease, erythema multiforme, ulceration of foot pad, mouth and vaginal mucosa. Immunological disease mostly occur due to hemorrhage into the CNS from disseminated intravascular population or acid-base electrolyte disturbance. Concrete infection with virus such as CD. Diagnosed as a clinical signs: leukopenia, abnormal coagulation test, slide agglutination test, and indirect fluorescent antibody test. And the specimen we can use for fecal antigen ELISA, PCR, fecal electron microscopy. Postmortem lesions: thickening and segmental discolored with denudation of intestinal mucosa, presence of dark, bloody and watery material within the stomach and intestinal lumen. Necrosis of cleft epithelium in small intestine, villi are shortened. Collapse of lamella propria and intestinal villi. In CPT, two regions, jejunum, ileum, lymph node and other lymphoid tissue contain intranuclear including bodies, necrosis and depletion of lymph nodes, hemorrhage in ileocecal area. Myocarditis, cross lesion seen as pale sticks in myocardium. In treatment, there is no specific treatment for Parvo, so we give symptomatic treatment to restore fluid and electrolyte to prevent secondary bacterial infection. For fluid therapy, fluid of choice for Parvo we use finger lactate solution. For antimicrobial agent we use ampicillin, gentamicin, ceftriaxone. In anti-emetics we use neopatent, ondansetron, metoclopramide. In gastric protection we use ranitidine, cimetidine. And in anti-inflammatory drugs we use enzyme. And for other than this we give glomerulocyte stimulating factor, which stimulates the body metabolism to produce WBCs. Transfusion of whole blood. Transfusion of whole blood, plasma transfusion, immunoglobulin therapy, and anti-diarrheal are not recommended. Feeding is contradicted. All the agents should be given only after the correcting of dehydration. For prevention, immunity after infection, immune to reinfection for at least 20 months or for the lifetime. Serum antibody titer remain high for the prolonged period after the CPD enteritis, even if the re-exposure does not occur. Attenuated live vaccines. The vaccine of pregnant witches is contradicted because disease will develop in fetus. There can be transient lymphomania for 4 to 6 days. Modified live vaccines we give at 6 to 8 or 4 to 16 years of the age, followed by 1 year booster, and every year antibodies start developing after 3 days of post vaccination. High titer attenuated live CPD vaccines, more immunogenic and effective. For control, the main control for rodent and insect vector control, diluted household bleach with water, effective and economical. Hydrogen peroxide we use to clear doors and clear the area during after the recovery with inactive the virus, as shown in picture. We can use hot flame fire flame gun to clear the area.